Breaking news, President Trump declaring his support for the long-awaited Republican plan to replace Obamacare.
We're going to have something that's going to be much more understood and much more popular than people can even imagine.
Late today, the House Speaker Paul Ryan guaranteed, in his words, he would have the votes needed to get the bill passed in the House. But plenty of Republicans say they are not on board. Phil Mattingly is out front, beginning our coverage on Capitol Hill.
This is Obamacare gone.
Less than 24 hours after the House GOP Obamacare repeal bill finally saw the light of day,
This is the first and most important step to giving relief to Americans from this terrible law.
House and Senate conservatives are already threatening its very existence.
I think the bill as it stands really is dead on arrival. I don't think it's going to ever arrive in the Senate. I think it's dead on arrival in the House.
Bolstered by pressure from outside conservative groups, including this rally from Koch brothers-backed Americans for Prosperity, just a football field away from the Capitol building.
They're going to have the shortest-lived majority in the modern era if they fail to fully repeal Obamacare.
The early revolt creating a very real math problem for Republicans, whose majority in the House, given the unified opposition among Democrats and 5 vacant seats right now, allows leaders to lose just 21 votes, or in the Senate, where Republicans can only afford to lose 2 of their 52 members. Moderates have long been wary of looming Democratic attacks on how many people the bill will actually cover, something sources tell CNN the Congressional Budget Office has told GOP leaders will likely fall far short of Obamacare's projections.
What matters is that we're lowering the cost of health care and giving people access to affordable health care plans. Look, the government will always win the war on government-run plans, saying if we mandate everybody buys what we say they have to buy, then the government will always estimate that they'll buy it. I just think that's bogus.
Conservatives remain increasingly skeptical of the refundable tax credits that would replace Obamacare's subsidies in providing aid for individuals without employer insurance to purchase plans. Then there's the restructuring of Medicaid, a hot-button issue across the country given the program's expansion many states took under Obamacare. 4 GOP senators said they will oppose any bill that doesn't protect enrollees in their states. This, GOP aides tell CNN, is the moment when some White House muscle will be needed. President Trump today meeting with top House vote counters and urging support for the House plan.
I really believe we're going to have tremendous support. I'm already seeing the support, not only in this room, I'm seeing it from everybody. And I got elected to a certain extent, I would say pretty good little chunk, based on the fact repeal and replace Obamacare. And many of you people are in the same boat.
And Erin, I can tell you, based on conversations I've had with House leadership, lawmakers, and top aides over the course of the last couple hours, they feel confident they can get this bill to the right place. But there's no question they're going to need help. And that's exactly where President Trump, Vice President Pence, Health and Human Services Secretary Tom Price come into play. All of them working on the Hill over the course of the last 24 hours or so to try and move this bill forward. One House leadership aide I just spoke to said, look, tell me these conservatives will turn down the president, not just by phone, but to his face when he tells them that they need to get on board. When that happens, then they'll think they're in trouble. But the reality here is they don't have a clear path to that majority yet. There's still a lot of work to do, Erin.
All right. Thank you, Phil. Out front tonight, Republican Senator Rand Paul. He's introduced his own health care bill. And, Senator, I appreciate your time. We just heard you say the GOP leadership bill is dead on arrival. The Republican president, of course, says he supports it. Are you worried about taking away the one chance you may have to actually get rid of Obamacare by refusing to vote for that leadership bill?
Well, I actually think there's actually much more unity than people think. One of the things that's united Republicans really since 2010 is repeal. So I think we're very, very united on repeal, not so much on replace. And so I think the real problem is adding replacement to the repeal bill. We voted about a year ago on repeal, and it was nearly unanimous. I think we could do that again. But on replacement, we have different ideas. You know, my idea of replacement is really not a new government program. It's allowing the marketplace to work. The new House plan is a little bit more Obamacare light than I would like. But I think we could vote on various replacements, even let the Democrats have a vote. We should have a variety of replacement bills. But I think the repeal bill probably won't pass unless we take replacement off of it.
what I don't understand here, though, is that, you said you want to repeal and replace at the same time, right? That's crucial to do. So, sure, you can all agree on repeal, check that box. But if you can't agree on replace, what's the point, right? Why not just put it all in one bill and fight it out till you get it right? Because you can't repeal without replacing.
Well, no, I want to do it on the same day, so I do want to repeal, and I think that unites us. I don't think we're as united on replacement, but I actually think there might be some bipartisan shifting back and forth, and that there might be Republican and Democrat coalitions on replace. I think that we all want the same thing. We want less expensive insurance and more people to be insured and more people to get health care. We just have different approaches to how we get there, but I don't think it's impossible to find some agreement. And ideally, we would be more united as a country if it weren't just coming from one party.
So the president has said he supports the GOP leadership bill. Here's what he said about it.
This will be a plan where you can choose your doctor. This will be a plan where you can choose your plan. And you know what the plan is? This is the plan. And we're going to have I think we're going to have a tremendous success. It's a complicated process, but actually it's very simple. It's called good health care.
Senator, is there any way in which you would vote for the GOP leadership bill because it is the bill out there and it is better than Obamacare?
I spoke with the president this week, and I don't think we're that far off, really. He's for repeal of Obamacare, and so am I, and so is every Republican. But I did express with the president that I think separating repeal from replacement will get it done, and I think that's maybe the only vehicle for getting it done. And the reason I say that, there is still some disagreement on the specifics of the replacement, and I'll give you 3 or 4 different ones very quickly. The Obamacare Light that the House leadership is promoting keeps some subsidies but renames them refundable tax credit, keeps some Obamacare taxes, but I just don't think that's what we stand for as Republicans. But it also keeps subsidies to insurance companies, and it keeps the form of the individual mandate. You have to pay the mandate to the insurance companies. Those 4 items do separate us, and so I think we can have a coming together, but it'll be on a repeal bill, probably with the replacement bill as a separate vote.
All right, Senator Paul, thank you so much. I appreciate your time.
Thank you.
Out front now, Republican Congressman Greg Walden. He's the chairman of the House committee that oversees health care policy, the Energy and Commerce Committee. And thank you for being with me, Congressman. Senator Paul, not the only critic of your plan. Several members of the House, of course, have spoken out against it today. Are you sure that you have the votes in the House right now to pass it?
I am. I think we're in very good shape, especially as members actually have a chance to read the bill. You can do that at readthebill.gop. Everybody in America can read it. It's not that long. I think we've struck the right balance. We're getting positive feedback as well. And so I'm confident as we go into our markup in the Energy and Commerce Committee tomorrow and the Ways and Means Committee tomorrow that we will move forward in a positive direction for the country and keep our promise to replace Obamacare with real meaningful modernization of Medicaid and the healthcare markets.
I spoke to the director of the ratings agency, Standard & Poor's, today. He's analyzing your plan there. And he says, overall, your plan will result in 2 to 4 million people losing coverage on the individual market, almost all of whom are over the age of 45, another 6 to 10 million who will lose under Medicaid expansion. These are older, poor, and sicker people. Do you worry about the morality of this?
Well, let's go back to the facts of this, and that is that takes in isolation our bill as if nothing else was going to happen. Under the Affordable Care Act, some 1,400 different authorities were delegated to the Secretary of Health and Human Services to affect this market in a positive way. Second, what we do know is the CBO projections when Obamacare passed were off by about a 2-to-1 ratio of how many people would take insurance.
We don't have any CBO projections for your bill.
Well, let me finish. The CBO said that there'd be twice as many people taking Obamacare insurance as there actually are. And by the way, 54% of those who paid the penalty to the IRS or got a waiver under the age of 35, which is part of contributing to the death spiral. So we're trying to reform this market in a way that works for all Americans and gives them choices. Last year, there were 225 counties that had only one option for people. This year, it's 1,022. That means 1 out every three counties in America. If you're a consumer looking for insurance on the exchange, you have one choice. That's before Humana pulled out and before Aetna's CEO said this market's in a death spiral. So we're trying to save this market, get it back to where it works for the American people.
Now, I know, look, S&P, they don't agree with you on the death spiral. Aetna obviously is a for-profit company, so there are other things there that they are considering in terms of profitability. But what about the fundamental point, though, of people who are going to lose coverage, especially in Medicaid expansion?
Well,
the old
well,
and the sick. What are you going to do about those people?
Well, first of all, we have several support mechanisms for them. In the Ways and Means Committee, you'll see come forward tax advance refundable tax credits. That means every month they basically get a tax support payment to help them cover the cost of insurance premiums. That's one. Two, there's a patient stability and state stability fund we're going to put $100 billion into over the next 10 years that allows states to come in and help those very people you've identified, because we don't want to pull the rug out from under them. But the bottom line is there isn't going to be a market for anybody to buy insurance on the exchanges if we don't come in and fix it. And you can say one company's profitable or not. By the way, nonprofits and profit-seeking companies are all pulling out of the exchange. That is an undeniable truth and something we've got to go fix before it collapses.
All right. Thank you very much. I appreciate your time, Congressman
You're welcome.
Walden.
Thank you.
And out front next, the U.S. deploying an anti-missile system against North Korea. We're going to show you exactly how it works. And the daughter of an undocumented immigrant speaks out. Her mother is told today she must leave the country.
I couldn't breathe. I was choked up. I couldn't talk at all.